tolerability as well as their safety profile. The dermatological side effect or the cutaneous reaction for these are there, which we do not frequently see in our daily practices. And among the antidepressants, escitalopram remains one of the most prescribed antidepressants, followed by sertraline as quoted by the studies. For my case, I'm presenting a 35-year-old male. He presented to psychiatry OPD with 2 years complaints of decreased sleep, apart, frequent loose stools, low mood, frequent irritability, and had multiple psychiatric consultations over the past 2 years and was often not compliant on treatment. He was already taking tablet fluoxetine 40 mg along with olanzapine 2.5 mg at night and alprazolam multiple tablets off-label, which was not prescribed by the psychiatrist for his sleep and anxiety. He came to us with the complaints of wanting to taper out alprazolam and reported that whenever he tried to stop, he had multiple episodes of ghabrat, low mood, and loose stools. Patient detailed mental status examination revealed that he had poor eye contact, was apprehension about the treatment, was restless, and diagnosed as a major depressive disorder along with irritable bowel syndrome. Patient was again and again apprehension about the treatment and wanted to be a part of the treatment regimen and what we can and cannot prescribe to him. Patient was switched over to escitalopram 10 mg at night along with the combination of clonazepam and propranolol 0.5 and 20 along with olanzapine 2.5 because he insisted he could not sleep without that and started tapering slowly. The patient started noticing a morbilliform maculopapular rash on the skin after starting the treatment on 15-day follow-up. The patient was educated about the treatment and about the drug compliance and about how he should not take over-the-counter medications while being on treatment. On follow-up after 2 months, he reported of these rashes and he had been scratching it again and again. Escitalopram 10 mg and clonazepam 0.25, which was tapered out. He reported of rashes only after starting this particular treatment and vanished after some days when he stopped the treatment. Patient was not taking any other drug at that point of time and had no family history of any other allergy or drug reaction. After stopping the medication, patient himself stopped the escitalopram and then started taking fluoxetine 20 mg by himself. As he started noticing improvement in his moods and complaints again, and this is a resolving rash, this is around 3 to 4 months of follow-up. Discussion, the patient dermatological review was sought and ruled out any kind of skin lesion or morphology, and he also ruled out allergy. Patient had not experienced